Hello, I'd like to welcome everyone to our COVID conversation, which is being co-hosted by Jack and Jill of America and the National Urban League. My name is Leanne Jackson. I'm a Jack and Jill mom, and I will be moderating the discussion today. Our webinar is focused on the COVID-19 vaccine and bringing information to the African American community in the Chicago area, primarily to answer any questions you have about the vaccine, but we're also looking for any questions you may have on the mental health aspects of coronavirus, on schools, your kids, on the illness itself. And while this webinar is targeting the African American community, we did open it up to the public. We want anyone to be able to access this information. We have reached out to a distinguished panel of experts who are in the African American community so they can address questions that relate to our community, which has been the most impacted, one of the most impacted communities of color by COVID-19 itself. So as we're getting started, feel free to please put any questions or comments you may have in the chat, and we will be looking at those and answering as we can throughout this webinar. And in order to get us started, I want to introduce our experts who are on the panel, starting with Garth Walker, who is a MD, MPH, an academic emergency physician, public health leader, and recognized care expert. We also have Carolyn Dr. Fitzpatrick, I should say. She's a Jack and Jill mom, and she is the medical director of the Dr. A.L. Burdick Family Medicine Center, where she maintains a patient panel. We have Dr. Trevon Thompson. He is a Jack and Jill dad. He's an emergency physician, a medical toxicologist, a tenured associate professor and the associate dean for admissions at the University of Illinois College of Medicine. And I do want to add that we have also, let me see if we're missing anybody from the panel. I do have one more person I would like to introduce. Just give me 1 second. Who am I missing? Dr. Sue Barclay is also on the panel. But before we even get to our panelists, because we also have someone from the Illinois Department of Health with us and private physicians, but I want to explain who Jack and Jill of America is to anyone who might be joining us who's not with the organization. I want to introduce our president, Rashida Derrico, to give a few words about Jack and Jill and explain a bit about the organization and why we wanted to do this as well.
Awesome. Well, thank you very much, Mother Leanne. Hi, my name is Rashida Derrico. I am the president of the Western Cook County chapter of Jack and Jill of America. Our chapter actually has the boundaries of the west side of Chicago and the Western Cook County suburbs of Chicago. We are an African American family organization for children from the ages of 2 to 19 for their families to support them as they go through growth and development. We provide programming as it relates to financial literacy, advocacy, social platforms, health and education, healthy living, and STEAM activities. This activity today that we're bringing to you in conjunction with the Illinois Department of Health and the Urban League is really around talking to communities about the importance of what's happening today in our environment as it relates to COVID-19, to answer your questions that you may have, and to give us a platform that we feel comfortable sharing and discussing this really timely topic. I want to just say thank you for joining us today. And on behalf of the Western Cook County chapter of Jack and Jill of America, I welcome you to our forum and discussion. Thank you.
Thank you, President Derrico. And now I'd like to introduce our another member of our organization, MAL Donaldson, Marvis Donaldson, to give a few words as well.
Hi, everyone. My name is Marvis Donaldson, and I am the Regional Foundation Member at Large for the Midwestern region of Jack and Jill of America Incorporated. And I just want to bring greetings from our Regional Executive Board under the direction of our Regional Director, Tanya Watson. And I also want to say thank you to my amazing chapter. I'm also a member of the Western Cook County chapter. Also to the Chicago Urban League for co-sponsoring this with us, and to our esteemed panelists for being a part of this very important conversation and bringing this to our community. I know the conversation today is going to be informative and insightful, And I'm excited to get this started. So thank you for having me, and I'm looking forward to the conversation. Thank you.
Thank you, MAL Donaldson. And Dr. Fitzpatrick is a mother here in Jack and Jill. She is the chair of our Health Initiatives Committee. Would you like to say a few words, Carolyn, about why we decided to do a COVID conversation right now?
Sure, absolutely. First, I just wanted to thank everyone for joining us today. Thank you to our Jack and Jill family for supporting this event. MAL Donaldson, representing our Midwestern region, and our chapter president, Dr. President Derrico, excuse me, of our Western Cook County chapter for being present today and bringing us greetings. So thank you also to our co-host at the Chicago Urban League, Dr. Garth Walker, Deputy Director of the Illinois Department of Public Health, and all of our panelists for being here. As chair of the Jack and Jill Western Cook County Chapter Health Initiatives Committee, I would like to acknowledge my committee members that worked so hard on envisioning and putting this event together today. So thank you to mother members, Tracy Elizabeth Clay, Calmetta Coleman, Leanne Jackson, and Nicole Thompson. I'm so proud to represent our chapter and Jack and Jill of America. It is because of our call to service and duty that the Western Cook County Chapter Health Initiatives Committee developed this program, a COVID conversation, to help improve the health of our families. We saw the need and answered the call to do our part to help decrease the spread of COVID and increase vaccination rates in the Black community by promoting information education. As we mark this first year anniversary of when the COVID pandemic occurred, we have seen the disproportionate effects on our Black community with higher rates of infections and death. Now, 1 year later, we have not only one, but two, but three vaccines, wow, to decrease the spread of this devastating virus. However, the same healthcare disparities that caused us to be more at risk for being infected with COVID are also limiting access to receiving the vaccine. So I look forward to engaging in conversation with everyone today as part of the panel with my esteemed colleagues that are present today. Thank you for attending. I hope you enjoy the program.
Thank you, Carolyn. And we are very grateful to the Chicago Urban League for co-chairing this, co-hosting this with us. And one of our Health Initiative Committee members, Calmetta, can speak a little bit about that.
Hi, everyone. Thank you so much for joining us. My name is Calmetta Coleman. I'm Executive Vice President of the Chicago Urban League. We are an organization that works to achieve equity for Black families and communities through economic and social empowerment. As Dr. Fitzpatrick has mentioned, we are very well aware of the disparities that come to the Black community that have been seen relative to COVID-19 infections and death rates. And now that the vaccines are out there, the Chicago Urban League is very concerned with making sure that the Black community in Chicago and across Illinois has access to the best information about the vaccine to help them make informed decisions, as well as making sure that there is equitable access to the vaccine itself. So we're delighted to be a part of the program. And moderator Leanne Jackson, at this point, I'd actually like to conduct a poll. So I'm going to open that up now and ask everyone who's on if you would respond to the questions. Can you see them?
Yes, we can see them.
Okay, so I'll give people there are 4 questions, they're short. I'll give people about 3 minutes. And I apologize while you all are taking that. I know some people are also joining us via Facebook Live, so you wouldn't be able to take the poll, but if you want to drop some questions on our Facebook page, we'll be happy to take a look and try to get to them during the conversation. All right, right now, we're about at 73% of attendees who have voted. I'm going to give it like another minute to give people a chance to finish responding.
And while we're conducting the vote, I actually just wanted to update Dr. Barclay's information because she is a board certified pediatrician and currently a senior attending physician at Mercy Hospital and Medical Center. And we're happy to have her involved because a lot of parents on this call may have questions and want more details on when a children's vaccine may be developed and also any other questions regarding schools and children and coronavirus. So thank you. And I also wanted to say that Dr. Walker delivers emergency care. I don't know if I read this part. Dr. Walker delivers emergency care at the Jesse Brown Veterans Affairs Hospital. But even more importantly, he is the Deputy Director of the Illinois Department of Public Health, where he heads the Office of Men's Health. So he is here to talk to us about how the state is spearheading efforts to get the vaccine out there, disseminate it to the most vulnerable populations, and when we can all expect for that to open up and how it's going. So we will be talking with him more about that.
Okay, I am going to close the poll now. Looks like about 81% of folks have voted. So I'm going to assume that maybe some people are abstaining. And I am going to share the results. Can you all see the results? I'll just walk through them. So the first question was, have you already received at least one dose of the vaccine? 68% of folks said that they have. We've got 32% of folks who said no. People over 65 are currently being prioritized to receive the vaccine. Of all of your family members in this age group been vaccinated, 50% of folks have. You all can see the numbers there. And if you have not yet received the vaccine, do you plan to? So it's nice to see that no one said that they are not planning to. So that's good. And what concerns do you or members of your family have about the COVID-19 vaccine? The first one was the vaccine might make me sick or give me COVID-19. 23% of folks said that was a concern. The vaccine might have unknown long-term side effects, 68%. The vaccine was developed too quickly, 55%. I'm nervous about vaccines in general, 14%. The vaccines that are currently available might not work against new variants of the coronavirus, 55%. And there is not enough vaccine available for everyone who wants it. 32% of folks cited that as a concern. So hopefully we can get any of the questions and concerns that people have addressed during this discussion. So for now, I am going to turn it back over to our moderator.
Thank you, Mother Coleman. Well, we have gotten some really interesting data from that poll, and it will be insightful to find out from some of the panelists if this reflects what you're hearing from patients, from what you're seeing out in the community and that sort of thing. To that effect, I'd like to start with Dr. Walker because he is with the Illinois State Department of Health. And if you could talk a little bit for a few minutes about what you guys are doing to get the vaccine out there to the most vulnerable populations and what you're seeing in terms of people being willing to take it and that sort of thing.
Sure. Thank you, Leanne. And thank you guys for having me. I really appreciate giving me the opportunity to be with you all today. And thank you again for all your leadership in terms of what you've been doing for the Black community. Uh, from the IDPH standpoint, what we've been doing, we have several roles, but with respect to the vaccine, we work with local health departments to not only distribute vaccine, typically outside of Chicago. Department of Public Health gets their vaccines directly from the federal government, but we distribute essentially throughout the rest of Illinois. We also lead messaging in terms of what is accurate messaging around the vaccine. And then with respect to vulnerable populations, what we've done is start an initiative called Restoring Our Communities. We've been partnering significantly with Black and Latino community-based organizations, fraternities, alphas, sigmas, men's health basketball leagues, you name it, and doing town halls similar to this fashion, addressing frequently asked questions. We've been doing that over the past several months. And the positive thing about that is from a vaccination hesitancy standpoint, we have seen a lot of improvement within the state, but also nationwide. When it comes to the African-American community, we rightly have apprehension in the sense that it's a very colored history in terms of how our healthcare system has interfaced with the African-American community. So it's right to be able to ask questions, get an informed opinion, and also, most importantly, seek who has our best interest. And we've been discussing a lot about that, discussing a lot about the role of National Medical Association, their role in terms of evaluating scientific information and what that means for us, but also just addressing any type of misunderstandings and what is currently out there and why it's so important, not just from a medical standpoint, but from a social and economic standpoint. And vaccination hesitancy numbers have trended down. And now we're transitioning a little bit more into not just information sharing, but also sharing what are some of the innovative ways that we've observed different type of municipalities and community-based organizations are doing to be able to get some of their most vulnerable vaccinated. And oftentimes that means being very honest about a lot of the structural barriers that are currently that our community faces often. You're on mute, Leanne.
What's interesting about the vaccine hesitancy discussion is that anecdotally, personally, I find that people are more eager to get the vaccine. And I'm wondering what you're seeing out there in terms of the ability to find and get it versus people who you're trying to urge to get it.
Yeah, so it depends. I've received inquiries from faith-based leaders that says a lot of their community is still hesitant about taking the vaccine and has a lot of questions. And then I've also received feedback that they have a lot of people willing and ready. The reality is that over the past month or two, there has not been enough vaccine to go around. So we've had to be very clear about who is eligible, and that's part of it. And generally speaking, people who are 65 and older, healthcare providers, now expanding to those with certain medical conditions, are the ones that are eligible for the vaccine. And not every area is going to have enough vaccine to vaccinate the demand that is currently within that area. So not only IDPH, but CDPH, as well as Cook County, has been setting up different type of programs that are targeted to specific zip codes throughout the Chicago area to ensure that those zip codes are prioritized. Currently, of those that are vaccinated, we have about 1.4 million fully vaccinated. And of that 1.4 million, about 7 to 8% are African American. So still less than the representation that we see throughout Illinois. So we still have a lot of work to do, and we still have a lot of communication, as well as a lot of hard work in terms of collaboration. But there's so many people that are doing so much good work, and we want to be able to make sure that we amplify that so that we can replicate best practices, as well as motivate individuals that just need a little bit more encouragement and a little bit more confidence in terms of making sure that it's safe for their family members.
Thank you for that. And I'm sure we'll be talking more about any specific concerns that people have. I'd like to get some comment from Dr. Thompson, who is an emergency physician, because, up until recently, well, not even up until recently, but for a long time, I mean, the ER was in the first line of dealing with this and trying to figure out how to keep people alive. What is happening now on the ground in terms of emergency rooms around the country? And are there any new techniques, innovative treatments going on? And what are you seeing, Dr. Thompson?
Yeah, thank you for that question. We are certainly in a much different place than we were a year ago. There was a lot of uncertainty, a lot of fear even, and a lot of miscommunication and even disinformation regarding COVID, even again, just a year ago now. And so in the initial stages, it was unclear what was the right level of PPE to use to take care of these patients, and how do you place them in rooms in hospitals next to people who might not have COVID? How does the nursing care work? Just so many compounding questions that were not known at the time with how to take care of patients, particularly those who need to be admitted to the hospital. I think it was one thing to tell someone, you have COVID, you're not so sick at the moment, kind of self-isolate at home. But those hospitalized patients were some initial challenges for us. Fast forward now a year hence, and we are in a much better position. We have a lot better understanding of the transmissibility of the disease, what level of PPE, the personal protective equipment, to use when taking care of these patients, how to room them in the various parts of the hospital, how to take care of them when they're in the ICU versus when they're not in the ICU. And we've developed much better protocols, even in the emergency department, for where to care for these patients, how to care for these patients, and then how to keep everyone else in the hospital and in the emergency department safe. So we've really come a long way in this year in recognizing and understanding how to take care of this. I will say again, at the heart in the height of the pandemic, maybe around this time last year, the summer, and then we've had a few peaks, things were pretty grim, to be quite honest. We were having lots of patients coming in with COVID, a lot of patients who were seriously ill, and a lot of patients who unfortunately died from the disease. Important for this audience is there was a lot of Black and brown people who were dying from this disease. It was very obvious from the very beginning, at least in my institution, that there was a huge disparity as to who was contracting the disease and who was dying from it. It's been a big journey, to be sure. I will say now we are seeing, I think for a combination of reasons. One, I think we're at a place now where information is seemingly much more trustworthy. I think the sources of information are much more scientifically based than maybe at some other parts of time during the pandemic. We are seeing, I'm hopeful that we are still seeing good measures being taken by the population. Certainly when we have measures that reduce spread, those measures work. When people are masking, staying away from other people, we are seeing the benefits of that. And then we are certainly seeing the benefits of mass vaccination. So we are at a point now where our numbers are much lower, at least in Illinois, and I'll say that, and at least particularly in my area in Chicago where I work, our numbers are much, much lower than they have been for quite some time, which is a good thing. But while that is reassuring in one end, I am happy to not see people so sick. I'm happy not seeing people die as frequently as before. I don't want to give the false sense of security just yet. When we reduce measures, when we stop wearing masks, when we gather in groups and those sorts of things, the numbers can go back up again. So I still recommend caution as it relates to keeping ourselves safe and keeping these numbers low. But assuming that we can keep this trajectory, that people continue to wear their masks, they continue to stay physically distant from others, and that as soon as everyone is able to get the vaccine, whether that's by eligibility criteria, availability of vaccine, et cetera, as soon as you are able to do that, I strongly recommend that you do that. That is really our only way to get out of this pandemic. And so I'm hopeful that we can continue this downward trend of cases, at least in our jurisdiction, and that we will continue to see overall a positive benefit here. I will say, though, and it's important to keep in mind that there are some jurisdictions, maybe not in Cook County proper, but in other parts of certainly the United States, and Dr. Walker may be able to speak more about other jurisdictions in Illinois proper, but the numbers aren't necessarily as good as we're seeing in Chicago right now. And so if you have family, loved ones, friends who are in other parts of the United States, it's important that they keep good track of or pay attention to what's going on in their areas, because we do see local phenomena going on. There are different types of rules and restrictions in different areas, different types of spread, different variants, et cetera. So it is important that you take precautions also based on the community spread and where you are as well.
Those are all really good points. And also, we do have a question we'll probably address later about eligibility for the vaccine when we're talking about who can get it and how to increase herd immunity. And I just have a follow-up question, Dr. Thompson, because there was a race to a vaccine to try, which makes sense, to try to develop herd immunity, to try to stop these numbers from growing in terms of death, in terms of transmission of cases. But in terms of treatment, which, goes to be, whether it's someone in the ER or just a medical doctor helping somebody who comes in with COVID, are we seeing any developments to try to mitigate the effects of coronavirus? Or is anything on the horizon?
That's another great question. So there are several treatments that are already out there. Most of them are still under emergency use authorization, which is very similar to the vaccines that are currently available. Unfortunately, however, there does not seem to be a magic bullet for COVID. And maybe some subsets of populations of people with COVID or a certain certain timing of the disease, perhaps some of these treatments may offer some benefit, but there truly is no magic bullet at this point. Probably I think the biggest thing that has probably helped in the care of COVID patients is from the medical perspective, our better understanding of the disease and how to better support patients through it. That is probably the biggest thing that has made an impact on the ultimate mortality rate from COVID. So unfortunately, no magic bullet. So if people are out there thinking that, it's no big deal if I catch it, they've got these treatments out there, I would not rest on that by any means, because nothing has really just shined as a bright light as this is the thing to treat all of these patients with. So in that regard, we still keep our guard up. The biggest benefit and sort of unfortunate in how this rolled out is we just got more experience taking care of these patients, and we realized some distinct subtleties in how to, particularly those that are going into the ICU, for example, what treatments that we can do to support them optimally as essentially their body is recovering on its own is really what we're doing. And when we decide, for example, to take over breathing for a patient and what types of additional supplements that we provide to them. For example, kidney failure can happen in COVID patients. When do we pull the trigger and provide some kidney support in the form of dialysis or some of the dialysis modalities that are out there? These are the sorts of things that we've sort of fine-tuned. Again, unfortunately, because of our experience with it, we were able to gather a lot of experience quickly because of how many patients we were seeing. So it was really unfortunate that we had to see the volume of patients that we did, but we did learn how to take better care of these patients, and we were able to fine-tune our treatments. Not to say, however, that this disease is still not deadly. I don't want to put that out there. This is still a deadly disease, but we are better at taking care of it now. So again, no magic bullet that's out there. Hence the reason we're still urging lots of caution, and really prevention is the best key here, and prevention by staying away from people and getting the vaccine as soon as you're able to do so.
Yes, exactly. It's dangerous, it's deadly, and we can't let our guard down, as you said. Thank you, Dr. Thompson. I want to turn it over to Dr. Barclay if you want to make some remarks. As a pediatrician, we have a lot of parents watching right now who have a lot of questions about how this is going to affect their children. Schools open, schools closed. And if you could speak a little bit about what you're seeing and what your thoughts are.
Thank you for the opportunity to participate today. This past year has been like no other in my 20 years of practice of pediatrics. I have gone from 25 to 30 patients in a day to so few I could count them on one hand during the early days of the lockdown. We learned to deliver healthcare over electronic media, and we caught it a joy when we had a healthy baby born into the world, but we also saw some of our greatest fears become a reality in the lives of my patients as their isolation spiraled them into depressed states. My actual experience with COVID positive patients has been limited, but I will share one story with you today. In the midst of the COVID-19 pandemic, the mother of one of my patients called me because her 9-year-old, previously healthy daughter returned home from a cough after visiting her father for the weekend. Dad also had a cough. Mom, however, was unaware of Dad's COVID status. Because the child did not have a fever and was otherwise her normal self, I provided instructions on symptomatic care of her daughter's cough, such as hygiene, humidity, drinking plenty of fluids, along with the current CDC recommendations to quarantine for 14 days at that time or until we knew Dad's status. The cough continued to linger over the next few days, and she became increasingly fatigued, having stomach pain and loss of appetite. After our second conversation, I arranged to meet her outside our facility because of concerns for the safety of the staff to perform a nasal swab for COVID while she sat in the car. The family was advised to go to the emergency room if my patient's condition worsened. Later that day, I was informed that her test was positive. I shared this knowledge with the family. Though my basic instructions did not change, I advised her to use fever control if she developed a fever. But over time, fortunately, all of her symptoms resolved, as we find in many pediatric patients. Currently, as has been stated, there are no drugs specifically approved by the FDA to treat COVID in children. As pediatric providers, we must decide if the child's sickness warrants hospitalization or if they can be cared for at home, which is also always a critical question. It is important that parents take steps to mitigate the spread of COVID-19 in children. All children over the age of 2 must wear a mask if they are able to do so. I have found some that have certain conditions that warrant them not wearing a mask, or that children, particularly with autism or other learning disables or disabilities, refuse to wear it. But all children over 2 should wear a mask. They must continue social distancing among non-family members, and it's important to teach children proper hygiene, including frequent hand washing for 20 seconds and covering their cough or sneeze. In addition to mitigating the spread of COVID-19, parents should remember that well child visits and other vaccines are very important, particularly the flu vaccine. Developmental surveillance and early childhood screenings are very important during this time, and we should not overlook them. While fewer children have been sick with COVID-19 compared to adults, children who do contract the illness can spread the disease, even if they are asymptomatic. And in rare cases, while most children are asymptomatic, in rare cases, they do become ill, requiring hospitalization, intensive care, including a ventilator use, and in rare cases, they may die. School readiness, I know, is a big question that many parents have. The American Academy of Pediatrics strongly advocates that all policy considerations for school COVID-19 plans should start with the goal of having students physically present in school. It has been demonstrated that opening schools generally does not significantly increase community transmission, particularly when the guidance outlined by WHO, UNICEF, and the CDC are followed, and I have mentioned those already. It is evident that schools and school-supported programs are fundamental to child and adolescent development and well-being, and provide our children and adolescents with not only academic instruction, but also social and emotional skills, safety, reliable nutrition, physical, occupational, and speech therapy, mental health services, and opportunities for physical and other benefits. Beyond supporting the educational development of children and adolescents, schools play a critical role in addressing racial and social inequities. The disparities in school funding, quality of school facilities, educational staffing, and resources for enriching curricula among schools have been exacerbated by the pandemic. Policymakers and school administrators should acknowledge that COVID-19 policies are intended to mitigate, not eliminate, school risk. No single action or set of actions will completely eliminate the risk of transmission of COVID-19. When will vaccines be ready? The first vaccines, as mentioned, have been released for teens at least 16 years of old. And the American Academy of Pediatrics recommends that anyone 16 years and older who meets the criteria in the phased implementation receive the vaccine. The COVID-19 vaccine for children, for younger children, will not be withheld from individuals, should not be withheld from individuals, adolescents who are pregnant or are breastfeeding. Clinical trials for children will be for the vaccine are underway for children as young as 12 years of age. And based on the current pace of research, may be possible to have a vaccine for at least some age groups of children and adolescents before the 2021-22 school year begins. So we look forward to that. Mothers who have newborns after testing positive for COVID can be reassured that most babies do not contract COVID in their first few days of life. Most of them will go home safely with the mother. The mother can breastfeed and interact with her child if she wears a mask and washes hands frequently. Children do feel the emotional impact of isolation and death that we have all faced during this past year. So it is important that parents are careful for the mental and to take care of the mental and emotional health of your child through age-appropriate discussions of COVID-19, increased interaction and play with younger children, and seeking professional help for yourself because you're their provider, and for the child as needed. Thank you.
Thank you, Dr. Barclay, for that comprehensive assessment of what's going on with kids and what parents should look out for and expect. Now, in terms of the schools, that has been a very controversial topic depending where you are. What I think is interesting, I mean, you alluded to or you specifically discussed the fact that resources at different schools are better. You know, some schools are better equipped than others. But I think it's interesting that some school districts like Chicago, for example, versus some suburban districts, even if the school's open, the amount of parents that want to send their kids back has been a pretty low percentage. What do you say to parents who have hesitancies because they feel like the schools may not have the resources, the ventilation, whatever else, and they feel a little bit worried staying home versus sending their kids back to school?
I have found that most parents do not want to send their children to school. Those that do send their children to school send them because of work conditions. You know, it's just not possible for them to work and watch the children e-learning while at home. Most parents find that very, very difficult. And they also find that children are not performing at their best when they are e-learning. That has been my experience. I tell them that there are things that you need to look for in the school. One is social distancing. Second is the mask wearing, to make sure that the staff and the other children are required to come to school each day with the mask. It's important that they have proper facilities for hand washing, be it or hand sanitizer. These three things are critical in school environments, in addition to anywhere else that you are in public. So I do encourage my parents to send their children to school because the social aspect of schools and the nutritional aspects and the developmental aspects are critical. And we are losing time with our children there are certain critical ages where it's going to be long, we are going to be hard pressed to make up that difference, that loss that we have had.
Yeah, it's very scary that it's been a lost year for many students. And
Absolutely.
I encourage parents to send their kids back to school for their own mental health, which is why I
Yeah.
Next, we have Dr. Fitzpatrick, who is a family physician. And so you can give us a holistic explanation of what you're seeing and what you're telling your patients, because you're on the ground, you're talking to people, you're seeing patients. Talk a little bit about that.
Sure. As a family medicine physician, I take care of people of all ages and stages of life, sometimes multiple generations of the same family, and some for many years. I've seen firsthand the devastation that COVID has caused in our families, spreading from one family member to the next in a household. So in the beginning of the pandemic, was answering many telephone calls that were coming in from patients and family members with symptoms and concerns. And we were really learning as we were going along in real time about how to, discover the best way of taking care of people and protecting our patients. In the beginning, we were told, well, people with COVID they have to have a fever, they have to have a cough. And, as I was getting the phone calls from my patients, they were telling me about other symptoms that they were having, like, they're like, I know this sounds funny, but I can't taste anything, I can't smell anything. And in the early days, we didn't necessarily know that. But I first learned that from, the symptoms that my patients were telling me when they were calling in. And then, later to come and find out that those symptoms were, very predictive of, people with a COVID infection. So, there was a lot of effort going on in those early days to, try and provide the best advice for patients about quarantining and testing and, do they need to stay away from work? When can they go back to work? All those sorts of things. And then at times convincing people to go to the hospital when their symptoms really were severe. And being at the bedside and the hospital when sometimes things hopefully went well, but unfortunately, far too many times when things did not go well. Holding the hands of patients as they, transitioned because their families could not be with them because of, restrictions that were in place in the hospital. And, family members are not allowed to visit. Again, at this time, just happy that we have more information about prevention and, treatment, happy that the rates are going down, and that we have the vaccines available. My experience with my patients is that, initially when the vaccines came out, just as we saw in our survey that, many were concerned about the safety of the vaccine. Some told me that they felt the vaccine was developed too quickly, just as we saw in some of those responses. And that there was a lot of people who wanted to take the wait and see approach. They wanted to see how others were doing with the vaccine before they made the decision to get it for themselves. Some were hesitant to get the vaccine because they might have another family member who's very against the vaccination, excuse me, and has told their family members that they shouldn't get it out of fear. So the patients, I talk to all my patients about COVID vaccination. I've even had some patients who, after our discussion will say, I think I'm going to go ahead and sign up and get the vaccine. But because I have family members who have expressed so much fear about it, I'm not going to tell my other family members right now that I'm going to get the vaccine. but maybe, tell them later once they've gotten, both of their doses. So there's all sorts of things, out there. And, and I just wanted to share also myself with people that I did receive the vaccine. I have received both of my doses. The only side effect that I had was just some soreness in my arm. And, I know that others have had mild symptoms from the vaccine, but usually those things go away within a day. And I do recommend the vaccine for all of my patients. And I know that early on people had trouble signing up for the vaccine. I have more patients who have been more successful in signing up on websites and that sort of thing in order to get access. And I just wanted to, highlight something that Dr. Barclay also touched on, and that is, preventative healthcare is still important in the days of COVID. And so, yes, we want to make sure that, we're preventing the spread of COVID, but we also want to encourage people to still maintain their preventative health care. So, getting routine screenings for things like, mammograms and colonoscopies and getting your blood pressure checked. Because unfortunately, we're also seeing, some advanced cases of cancer and other things that are occurring because people are skipping their routine doctor's office visits and screenings. So I just want to encourage people to to also still make contact with their doctor and maintain their preventative health. And also again the mental health concerns that we're seeing, increased rates of anxiety and depression, people being isolated from others has also led to an increase of those things. So, as much as possible, trying to reach out and connect with people. And it's also wonderful that we have the ability to, offer services like counseling, remotely or, by telephone or doing, FaceTime, those types of calls to support the mental health aspects of our patients.
That's a really important message about preventative healthcare and not letting other issues lapse while COVID-19 is going on, is ongoing. So now we're going to open it up sort of to the question and answer period. Anybody who's watching can submit questions, and also any of the panelists, please feel free to answer any of these questions, even if I direct it to one of the others. There's a big question about, of course, access, getting the vaccine. There's some questions about eligibility, which varies per state, and even within Illinois may vary a little bit as well. Dr. Walker could perhaps speak to that. And also in terms of if you're not directly eligible right now, you hear about people getting surpluses, or there's surplus vaccines out there. What's the fastest, easiest way to get those? And I also want to add, I was talking to someone recently who I hadn't heard that there's like groups like 1B. I mean, there's all these different groups. Someone who got it through a friend who runs like a health, who has like a food business. And he said, well, we were in 1B. So I was able to get it because they have a food business or something. So it sounds like there's a lot of criteria. If you could just speak a little to that beyond, we all know that seniors are eligible.
Sure. So I guess I'll start broadly with kind of the genesis of how the phases come into play. The goal is to focus on those who are most affected, who are most at risk, whether it be exposure, whether that be by what they do for a living, or maybe by the medical conditions that they may have. Initially, yes, we had 1A, 1B, 1B plus. It can all sound very confusing. But essentially 1A, we started with healthcare workers, right? We wanted to make sure our first line of defense was taken care of so that we can be able to manage the surplus of patients presenting to our ERs with COVID at moderate to severe disease. And then as we go through the phases, focus on our elderly, 65 and up. 90+% of the deaths are due to age. So our elderly are the most at risk. And then as we move to 1B, essential workers. So that can be people that deliver our mail, people that make our economy function, people that can't necessarily have a choice to work virtually. So grocery store workers, teachers, those are some examples of people that are eligible to get the vaccine. I think to your last question around, is there a way to get surplus? I'm unaware of kind of a centralized effort to do that. I guess in my heart of hearts, my thought process would be to make sure that we double down when we talk to our community about making sure we reach out to people within our family that are eligible, that are those that don't necessarily have the choices to be able to stay at home and work virtually, or are elderly, or have medical conditions such as end-stage renal disease, a condition that we know have a 15 times mortality rate compared to the healthy individual. There is the thought process that if there are vaccines that are about to expire, we'd rather have them be used than thrown away. So I've heard stories about places across the nation where they've had a few doses that were about to expire and they didn't necessarily have a backup list, so they had to distribute them within their network. But those stories don't come up quite frequently to me. So to answer your question, the phases, anybody that's eligible pre-1B plus can still get the vaccine right now. It's a supply and demand issue as well. So it's one of the positive things about that is that Joe Biden has made a lofty goal to make sure that everybody can get the vaccine by May 1st. And he has also increased the amount of vaccine availability. So there's been some very positive leadership. And I think a lot of people can start expecting for it to be much more accessible. But some of the barriers that we are seeing currently are often due to a lot of structural issues that have been in place for decades that unfortunately lie along racial and economic lines. So when we think about just the ability to use the internet, we saw that elderly that did not necessarily have that aptitude or exposure to be able to use the internet as efficiently as some other groups that affecting Black and Brown communities more often. So we've seen different community-based organizations phone banking and partnering with their elderly community to help bridge that barrier, while different institutions and people at the state are trying to figure out more creative ways to figure out how to make the vaccine more eligible. I'll stop there.
And maybe just to add a bit of a kind of a simple way of looking at it, but it really does highlight some of the disparity that Dr. Walker was mentioning. And that is an easy way to encapsulate this is that those who are most likely to catch COVID are at work, doing their job, doing what needs to be done, while those most likely to get the vaccine are those that have the flexibility to be at home or elsewhere on the internet, to sign up wherever they can sign up, and then the ability to go stand in line for however long it may take to do. So even, just to highlight that access issue, there is a disparity in who's able just to access the vaccine, especially given the fact that we're at a point where there's limited supply. Things will change, I believe, once there's more vaccine available, but with this limited supply and the fact that you often have to sign up, well, who can sign up? Those that have the luxury to physically do that act. Whereas if you have to get up and still take public transportation to work every day and you're at work, you don't have that flexibility. I think it was Dr. Barclay who mentioned, families that don't have the ability to even monitor their children doing remote schooling. And so these issues just compound one another over and over again, so that those who could benefit the most really don't have the access.
I'd like to add as well to Dr. Thompson's point. the phrase that we often heard most frequently was how COVID has lifted the curtain on the amount of disparities across every sector. I've heard the phrase ad nauseum, but it's true. When we think about the decisions that certain families have to make as a result of this pandemic, one of the most potent examples is when we think about children. We think about how much they've been affected by e-learning or delay in e-learning and not necessarily having great access to the internet. And then also, what is the opportunity cost in terms of staying at home versus going to a school that may not necessarily be in have all the resources, as well as maybe the resource in terms of being able to get that extra meal. So it's provided a lot of challenging situations that we've really had to look at our kind of moral compass and figure out how do we really prioritize and make sure certain communities are getting what they need. But that example is one of many that we're seeing, and we're just trying to continue to figure out what are some of the most innovative ways as well as fair ways to ensure that we are targeting those who are most vulnerable.
And it's unfortunate, it's sort of like a behind the eight ball effort because it's only recently with a new administration that's focused more on distribution and of course, communities of color and those who've been hit the hardest. So now there are efforts to ramp that up, but it's multi-layered challenges. And just specifically about the vaccine, we have a question about, doesn't matter which vaccine, anyone can answer this, which vaccine in terms of protection. There's been, not concerns with Pfizer at all, not concerns, but some countries have had different thoughts on different vaccines. Anyone want to speak to that?
Sure, I'll just mention that, yes, there's 3 different vaccines that are available, and whichever vaccine is available at the time that you schedule your appointment, that is the best vaccine for you. I would say, all of the vaccines are effective and all do, a great job of preventing the COVID infection, preventing hospitalizations, and the severe illnesses that we've seen related to COVID. So I don't think that people should be saying, well, I want to wait until I get this specific vaccine from this specific manufacturer. No, sign up, get the first vaccine that is available to you. And I know that some people also have the concerns about, well, the Johnson & Johnson is a single dose vaccine versus the other 2 manufacturers that are 2-dose vaccine. And, again, just think that you should, get vaccinated with whichever vaccine that you can receive the quickest so that we can, mitigate this, the risks of this pandemic.
Thanks, Carolyn. And yeah, it seems like most people are pretty open. 1 dose is better than 2, but whatever you can get first is most important. We have a question from somebody about addressing sort of like the long-term effects of the vaccine and it being created so fast. I just want to initially say that I think it's sort of just a testament to the ability of the scientific community when they put their minds to something, that this happened so fast and that there's money and everyone, a concerted effort. But of course, throughout the communities, throughout the world, there's questions about, how fast it was developed, also long-term effects. But there's been a lot of great testing so far. Who would like to speak to what we're seeing with vaccine results and potential long-term effects?
I'll just touch on that real quick, just because it is a frequent question. But of any vaccine that's been developed to date, this is by far the most scrutinized, vetted vaccine compared to any other vaccine in history. And I think with respect to the speed, most of it is administrative. Usually you have multi-steps around how things are regulated prior to it being released. What they did was kind of condensed those, but the science was not changed. The science that was applied to the virus was the same type of science that's been applied to every vaccine that your child gets, that you get, maybe when you're pregnant, or from the flu vaccine. And just to touch really quickly in terms of efficacy, the flu vaccine is roughly around 50 to 65% efficacy. When you look at Pfizer, Moderna, as well as Johnson & Johnson, Pfizer and Moderna are 95% efficacy if you take both doses. Johnson & Johnson is 80% against severe disease. And that's important because that's essentially how a lot of decisions get made. You know, when Dr. Thompson and I are in the emergency department, we're thinking about resources. Though that severe population are the ones that may be overwhelming our ICU, which is oftentimes a decision point in terms of closing our states. And when you think about just the ability for us to be able to do our job, be able to treat some of the most mundane emergencies that we see on a regular basis, when our hospital becomes very overwhelmed, our outcomes with respect to treating some of the most mundane emergencies becomes very challenging, just because the resources are limited. So when we see a lot of those big decisions made about closing, that's what we're targeting. So Johnson & Johnson is a great vaccine, 80% against severe, roughly around 60 to 70% against moderate, but it has benefits in the fact that it's one dose. And then when you think about vulnerable populations, about homeless, people that where continuity of care can become very challenging, it's a fantastic option. But yes, I completely agree with Dr. Fitzpatrick in the sense that if you have access to a vaccine, take it. It'll be the fastest way that we'll be able to get back to some normalcy.
I'd also like to say about the vaccines, I believe it's the Pfizer ones, or potentially all of them, were already actually either in development or being utilized in other ways, a lot of the underlying elements from what I've read in the past. So they were already circulating as sort of medical treatments in various ways, or being utilized. So there's that aspect, if anyone wants to speak to that. But also to Dr. Walker's comment about taking any percentage dose, like even if it's 70% from Moderna, it cuts fatality rates too, even though it may not, it protects you at some level. What's happening is we're making it less deadly. Is that right?
Dr. Thompson has something on the tip of his tongue, so I'll let him speak.
Yeah, no, I was just going to mention, the point that you made, Leanne. So the technology behind these vaccines had already been in development. So another way that I like to tackle it was created so fast concept is the specifics of these vaccines were created fast, but the technology behind them had already been in development and had already been deployed in other areas. So it was really a matter of modifying the technology for this specific disease process, not creating something ideally, all the way from scratch and having to recreate the technology from scratch. So modern day advances in vaccine development really did allow us to make this vaccine much faster than we might otherwise have seen. And then, as Dr. Walker mentioned, what we were dealing with here was a reduction in some of the red tape, so to speak, and moving things along. Not that the science was not good. And I'll tell everyone, I have received the vaccine myself, and my father and grandmother live in rural Virginia, where access is a little bit more tenuous to the vaccine. They have an appointment actually for this upcoming week to get theirs, and they're not even sure which one it is. And I told them, don't worry about it. It does not matter which it is, just get the vaccine. If it's the 1 dose, great. If it's the 2 dose, don't miss your second appointment. It doesn't matter. And this is what I'm telling my own family members. In fact, as soon as my children are eligible to get the vaccine, I will allow them to get it. And so it does not matter which. There's benefit regardless. And so it should be there. I think there's also some questions about long-term effects from the vaccine. The reality is we don't have long-term data on the vaccine, right? So being true to science, we don't truly know the long-term effects. I can tell you though, that based on what we do know about the vaccine itself, and compare that to the disease process, there's not a lot of expectation of long-term effects just based on what we know about it. But again, to be sure, we don't have the long-term data. I will say, however, that we are seeing there are real effects from COVID, the disease process. One, you can die from it. Let's not forget that fact, right? You can contract the disease and die. You can contract the disease and survive, but have severe disability as a result. You can have strokes and cognitive impairment and cardiac impairment, kidney impairment, et cetera, as a result of COVID. So the recovery isn't necessarily benign. And then I'm sure you've heard of the long haulers. So those who contracting COVID and are having long-term persistent symptoms from it. These are not benign as well. And so we're really playing, a weighing of what we know at this moment about the disease and what we are anticipating from the vaccine. And in my mind, and I think in the scientific world and the medical world, that scale tips in favor of the vaccine as opposed to the known complications from the disease process itself. And so that's how that calculus weighs in my mind. And I'll tell you again, I had no hesitancy as soon as the vaccine was available for me to take it. I had zero hesitancy to take it. In fact, I took mine on the first day that my hospital system opened up vaccines. I was literally running to the door to get this done. And so this is it's a real issue for me. Again, to put an exclamation point on this, I have pronounced more people dead in this last year than I have in any other single point of time in my career. That's not insignificant as an emergency physician. And so the calculus for me is simple, and that even if there are risks of the vaccine, I am comfortable that the risks would be lower than the risks from this disease, both on an individual level and certainly on a population level. Look at the 500,000 plus deaths from this disease, and that's not including those who are suffering from the consequences of the disease. So I'm putting a big point on this for a reason, but I do have a strong thought on this concept.
I'd just also like to add, so those long haulers, there has been NIH funding recently deployed for them to be investigated, kind of what's going on. And when they say long haulers, that means those that have gotten COVID, kind of recover, but still kind of have these ambiguous symptoms for a very, very long time. And just so people also know that typically when people have reactions to a vaccine, is usually very close to the time when it's been administered. So after a day or two, if you haven't had any, if the symptoms no longer persist, you're probably going to be fine. And typically when you get the vaccine, they're expected to watch you for like 15 minutes, maybe 30 minutes if you have a history of allergies. And we can discuss special populations in a second, but I just wanted to make sure we discuss that too as well.
That's a very good point. I'm glad you brought that up about how, you should expect any sort of after effects pretty quickly early on. And I think compared to other vaccines, that this is not, it's no worse, potentially better than a lot of the vaccines out there in terms of what they see in terms of side effects and that sort of thing. But Dr. Fitzpatrick, Carolyn, I did want to ask you about, because someone had a question about whether people will have to get the COVID, if you expect that people will need to get the COVID-19 vaccine yearly, like the flu vaccine. And I think another question that's sort of similar to that is the effectiveness of the vaccine on variants that are out there. That was a question we had, which they sort of go together in a way, those two questions.
Yeah, sure. And I know that the vaccines are effective against the different variants that are being seen coming from other areas of the country. And, maybe some of the other panelists have some of the specific, numbers in terms of that. But overall, again, the vaccines are effective and they are safe. While we are still learning the longer term effects, for the vaccines, we can also feel comfortable in knowing that, we also have an African-American female scientist, Dr. Corbett, who works for the National Institute of Health, that was involved in, in the research and development behind these vaccines. And it's important for us to highlight our African Americans who have been, part of creating solutions for this COVID pandemic, because we don't want these individuals to be hidden figures. And, it also just speaks to how much, all of us as part of the, health and research community are really, working together in order to, mitigate the effects of this virus. But yeah, if there's any other panelists who might know some of the more specific numbers about the vaccines and the variants, please share.
And whether like yearly, someone said, I guess booster shots was one term, or if you have to get this yearly.
So with respect to how frequent you'll take the vaccine, that is more so to be determined. We don't necessarily know how long the vaccine will be effective. It could very well be like the flu vaccine where you get it annually. But the good thing about that is that we have precedent for that. The other most important point around variants, and the reason why I think talking about that point is very important, is because it is an argument for urgency. Of the variants right now, we know that the UK variant is more deadly than the variant that we're most familiar with. But when we're trying to achieve what people say, quote unquote, herd immunity, roughly around 80% of people that are vaccinated and immune against the deadly virus, the longer that it takes for us to get there, the more likely it is for a stronger variant to develop. So let's talk about variants real quick. Whenever somebody talks about developing immune system against a disease, what they're doing is recognizing a structure. And our immune system, what we try to do is train our immune system to fight the current vaccine. So the analogy I like to use is like a boxer. If you go into a boxing match very cold, against somebody that has a very unique technique, you're either going to last very long or you're going to get knocked out. They're really good. If you have time to observe that technique, train for that technique, you're either going to last longer or you're going to knock them out. And so when we give a vaccine, what they do is they transcribe a very small portion of that protein and expose your immune system to be able to fight against the real deal in the future. So when you get the mRNA, it transcribes a portion of it. And if you get a live attenuated, you get a very weakened version of that virus so that it doesn't give you a more pronounced response. But what I'm really trying to say is that the more people we get immune against the vaccine, the faster we can stop this virus from developing more deadly variants. And if that variant is just a mild change in the structure, if you have a large variant, it becomes completely different type of virus. And therefore we have to develop a totally different type of vaccine. So that's why it's so important to make sure that we are encouraging our community, working together and making sure we're getting our most vulnerable communities vaccinated soon enough so that so that we can make sure that we don't give this virus time to develop a very deadly variant.
Thank you for that explanation, very clear. Is there we don't have any other, well, we did have just one question that if you've already had COVID-19, do you still need to get vaccinated? Can someone quickly address that?
Sure. So we know that if you have had a COVID infection, that you have some, brief immunity against the virus. And but the recommendation is that 90 days after you've been infected with COVID, you're eligible to receive the vaccine. That's the short answer.
That sounds good, because there have been people who said, I just got, also there was a question, or I've heard questions about if I just had COVID, some people say they can't get the vaccine immediately, but you're saying wait 90 days to get it. Is that accurate?
Yeah, that's the current recommendation, is to wait 90 days to receive the vaccine. Because you do have some brief, protection against another COVID infection. Your body has, a natural protection in the antibodies that get developed after you've had a COVID infection. But those antibodies and that protection wanes over time. And so that's why it's still recommended that people who have had a natural COVID infection should still get a vaccine. And the soonest would be about 90 days after you've been diagnosed with a COVID infection.
Okay, well, we have one, I think, final question so far. If anyone else has questions, please put them in the Q&A or chat box or otherwise, or on Facebook Live. But there is one question about what are the sequence of events and data that would determine if we will have to get a vaccine yearly, kind of a follow-up, I guess, on the question of a yearly vaccine.
I can maybe start with that one. So one, the vaccine trials are still ongoing. They're not done, even though the vaccines are out there. So we are monitoring those who are in these trials and monitoring things like antibody titers, for example, and seeing how long immunity lasts in the folks who have been immunized. That will be a big data point that will be used to determine, do we need a booster? Do we not need a booster? And then, as Dr. Walker mentioned, where are we with the variants? Are the variants changing so rapidly that perhaps this year's coronavirus works, the vaccine works for, but next year's it might not, which is something that's like the flu vaccine that we use. We know there's enough mutation of the flu every year that we need a new vaccine. So we'll be monitoring that as well. So those are just two examples of things that we are looking at to determine whether or not a vaccine, a booster vaccine or yearly or whatever you may want to call it, is necessary. And the variant point is a good one. It could be that the variants are small enough that this current vaccine is enough, and it could be that future variants are so large that it's not enough. We just don't know yet. One of the things I like to harken back to, very early, we were calling this the novel coronavirus. And in medicine, that term wasn't just another way of saying new. We truly meant novel in the sense that we have not been exposed as humans to this particular coronavirus. There are other coronaviruses out there, but this particular one, we have no experience with previously. Everything we learn about this disease, the virus itself, how it transmits, how to treat it, this is all new to us. So we are really learning as we are going along here. So we don't unfortunately have all of the answers yet. But the good thing about science, and this is what's one of the things that's troubling, is that science has become a political hot button. It should not be, right? Science is just conducting good studies and analyzing data. We should be able to figure this out. And this is what we are doing. We are taking our experience, we are taking the data that we have and making decisions based on what the science is showing us. So I am confident that we will, a year from now, if we have the same conference or the same webinar in a year, we will have new information to share about where we are, what we know now, and what the future might look like. So in some sense, we do have to ask that people bear with us as we learn about this. We don't have all the answers yet, but we will have answers. And that is the good part about this, is that we will be able, hopefully at some point in the near future, say, yes, you need a booster, or no, you don't. Or, the one shot is great. I would love it if the coronavirus goes away. It's not looking like that's really going to happen. It may be that we are dealing with immunization for quite some time, but it may be perhaps it will go away, like some other coronaviruses have in the past. We will see. And so we really need to follow where the science leads us in this regard. And something that was mentioned earlier about representation, particularly within the Black community, as it relates to hidden figures and that sort of thing, who's doing the what as it relates to this. I know there is a lot of concern in our communities, particularly given the history of, in this case, African Americans and our medical system, that there are real reasons to mistrust the system, right? There have been some horrible atrocities in the past. We are still dealing with systemic racism that's built into certain of these systems. We know disparities exist. So I'm not at all trying to say that that is not the case. What I can say is that we are in a point where there is much more representation, where we do have us at the table being able to make some of these decisions. We're able to look at some of the data to encourage participation in the research, et cetera, doing the research, as was mentioned. And I can say there is truly no conspiracy theory around this vaccine. And I don't mean that jokingly. Our community has reason to be distrustful at times. I can say, as it relates to the coronavirus and the vaccine, there is no conspiracy theory here. There is no trying to spread diseases within the Black community at this point and this sort of thing. To the opposite, we know this disease is affecting us worse. And we really do want to get vaccine penetration into the community so we can prevent our own from getting sick and dying from this disease. And so there are real reasons in this case, if you can believe those of us who are here on the panel, to trust us in this regard. At least in this moment, in this instance, the vaccine is a good thing for our community. And I strongly encourage all of us who are able, as soon as we are able, to get the vaccine.
And I'll be remiss if I didn't mention, I got the vaccine for everyone as well. And my mother, my father, both got vaccinated. My in-laws are currently scheduled. And it wasn't an easy discussion for both of them. I could see the apprehension on both of their faces. Anytime you take anything foreign, it will make somebody apprehensive, and we should give them that space to have that discussion. And then to Dr. Thompson's point about representation, research trials for Pfizer and Moderna, we had 10% representation, which is actually a fantastic number when you compare it to participation in prior trials. And to people at the table, National Medical Association has vetted the scientific data of Pfizer and Moderna and has made the estimation that we need to make sure that our community takes it. And those are some of the most important points that we bring up often when we talk to communities throughout Illinois. It's like, who is vouching for us, who is checking upon us, and who is endorsing us? Because oftentimes, like, science is science. You can talk about it ad nauseum, but what you want to make sure is that there are people there on your behalf, kind of balancing out and highlighting those points that affect equity.
I just wanted to add that I have gotten both doses of the vaccine, and I have encouraged family members to get the vaccine, and also coworkers that are hesitant to get the vaccine. I have encouraged them to get the vaccine. It is our key to safety, to being able to work in a safer environment, along with the other steps that we take toward mitigation. So I definitely support the vaccine and think it's the key to being able to socialize again, or one of the keys.
Sorry, I do have one more question that came up. Whether the vaccine, someone wonders if, and we may not have this data yet, but does the vaccine affect reproduction for girls and women?
The vaccine is eligible. Pregnant women are encouraged to get the vaccine, and it is about, there has been no evidence that it has affected the fetus.
Okay. And then I'm not sure if they're also referring to potentially future effects. I mean, that might not be the.
We have studied as long as they can study, so there isn't long-term data available. But for what the time period that has passed, that the vaccine has been available, that children have been born, and that women have become pregnant, the data suggests that it's safe in pregnancy and breastfeeding.
Well, these are all such important questions, and it's so great that we're having this discussion. I appreciate all of you, all of our panels for joining us, everyone who's watching for joining us. And this is the sort of discussion, again, it sounds, as all of you have emphasized, that have to be had with our family members, with friends in the community, coworkers. And I think emphasizing that we are, as a couple of you mentioned, we are in a different era. I mean, obviously there's systemic racism, there's health disparities at every level that still need to be addressed, but we are in a different era where Black people like yourselves have a seat at the table, where there are people in high levels of government watching over this. That wasn't the case in the past. So it's been a sobering and devastating year for the African-American community, and the vaccine is really sort of a glimmer of hope to try to put a lid on this, just the devastation that's occurred with COVID-19, all the deaths, all the fatalities, all the carnage. So I'm glad we're getting the information on the importance of the vaccine out to our community and that we have such an illustrious panel of distinguished African-American health professionals who can speak to all of these issues. I'm very impressed. We're all thankful that you joined us. And I believe that's all the questions we have. And thank you everyone again for your participation. And have a great afternoon.
Thank you.
Thank you.
Thank you.
Thank you.